Hello, Dr. Akhtar. So, in today's world of internet and social media, there is so much information, knowledge, so many influencers talking about diabetes, sugar, and all these terms. And you clinically practicing for 20 years, right? And you have seen thousands of patients and you studying diabetes so deeply. What is your perspective on this?
We all know India is the diabetes capital of the world, and we all should be. Why we are here today, the reason is we want it to become the diabetes care capital of the world too. We are the second largest producer of sugar in the world and the highest consumer of sugar in the world. So eventually we are learning now, and we are cutting down, although slowly, our consumption of processed sugars, and that is what is the root cause here: our dietary habits, our genetics. And there is a lot of information around now with social media, but patients, they need hand holding. Patient needs to be shown the way, and that is why filtering of the credentialed information, the right information which can help patients in managing this lifestyle disease called diabetes, would be helpful.
A new study is shedding light on a concerning medical issue many may be living with and not even know it. Nearly half of adults living with diabetes are undiagnosed.
10% of the population has diabetes, and by far, type 2 diabetes is the most prevalent. About 90% of people with diabetes have type 2.
So diabetes, it actually starts many years before we get to know. Somebody maybe experience the symptoms of diabetes, the so-called symptoms. You feel thirsty a lot, you have to go to the washroom often, you lose weight, but that doesn't happen for everyone. Diabetes can start silently, can be sitting inside us for years altogether before it becomes apparent or is detected in a, say, blood test. That is why it is challenging. The main reason why diabetes management is challenging is because it's silent. And so is the problems that it causes. It goes on silently, and if for some reason we haven't been able to look after it well, the complications start. We all are aware, we all have heard, seen someone suffering from those complications, the eyes, the nerves, the kidneys, and those things are unforgiving. That is why we always advocate that looking after it while it's still easier and more fruitful is the right thing to do. And that is why right awareness, right knowledge, and right participation from patients and doctors is required for this to happen.
Diabetes rate has more than doubled over the past 3 decades. Today, around 1 in 9 adults live with diabetes globally. That's more than 800 million people. But the bigger crisis is this. Scientists have been tracking this data across more than 200 countries, and this is for people aged 15 and older. 15 and older. And they say 44% people have no idea that they're diabetic. They are undiagnosed and therefore untreated.
Okay. You gave a very interesting point about we have to take care when it's fruitful. When you say fruitful,
Yeah.
what exactly is the phase in diabetes when it's fruitful?
Very good question. So before the complications have set in, so this brings in two more questions now. How do we get to know, like Doc, you said everything is silent. So how do we get to know that complications are setting in? Okay, I'm a diabetic. I have understood that I should look after my diabetes levels, and that is all I can do. So people need to know that what is that should happen from their end, apart from their involvement, their mindset, and their willingness to live better. So the periodic checks, that is officially a part of good diabetes management, and more places are accepting it, and people should also know about it. So periodic eye checkup, kidney checkup, nerves checkup, all the guidelines, the global guidelines that we follow for treatment of diabetes, they mention it that once in 6 months, once a year, your eyes should be checked, once in 6 months, your nerves should be checked. Because those things also, so the biggest stigma, the biggest reason that diabetic people suffer years down the line is these damages are irreversible. That's what makes it challenging. And then this vicious loop, this cycle keeps going on. Things don't get better, and people get disheartened. And of course, a patient won't feel good, he won't feel better. That is why early action, swift action, and targeted approach is what we need for long-term successful treatment of diabetes.
So how does a normal person, now a person getting up, in the morning 6, goes out for a walk, goes running, comes back, has proper food in the morning, goes to work, comes back, sleeps at 9 o'clock, gets up. This is a normal lifestyle. There is a bit of stress in work and everything. So how does that person suddenly go to type 2 diabetes? What is that shift? Because you talked about lifestyle, about people not taking care of themselves in the early stages. So how does a person just transition into that?
So what you just mentioned, that's wishful thinking for many of us, including me. So it's very tough to follow. These days, urban lifestyle, so many responsibilities, requirements, and we want to be a certain way, but it's tough. It's asking too much from a person. But yes, following a good, healthy lifestyle will delay it. This is definitely for sure. This is inarguable. So it is going to delay the onset of these chronic issues, diabetes, high cholesterol, blood pressure, fatty liver, if the person is able to follow a healthy lifestyle, low stress levels, healthy eating, physical activity, mindful eating, like you mentioned. Their onset and severity of these issues is definitely going to be delayed. Even, it can be pushed years down the line if following a good healthy lifestyle, of course.
So you talked about India being the capital for diabetes. There is so much of people being affected because of diabetes. So what do you think is actually lacking that people are not even yet aware, even though it's such a big issue right now?
So the lack of information and awareness, because these things creep in silently. If somebody falls sick, if somebody gets a fever, everyone gets to know, your body is hot, you have a fever. We fall down, we injure ourselves, there's pain, and it's obvious again. But somebody is having, high cholesterol since 3 years. No, nobody gets to know anything until unless fatty liver happens, until unless that increases the risk of diabetes and heart disease by 3 to 4 times. This is the biggest problem with these chronic issues, non-communicable diseases. And that is why now everyone is taking notice. The new data that came in 2 years ago, ICMR, Government Union Ministry pushed that data. And that has shown that 1/4 of India is diabetic plus pre-diabetic. 1/4. 1/3, little more, it was 37%. Little more than 1/3 of India has blood pressure. Around 40-45% of India has obesity. And all these three guys, they are very close friends. They run together. So if we escape them, we can, if we become aware enough, if we become vigilant enough, we can escape these things. We can delay these things, and we can definitely prevent their complications, their irreversible long-term complications from setting in.
So we have all seen like headlines. I've seen, big boards put up in front of parking gates and everything. Right, reverse your diabetes in 2 weeks. You told me that it's not reversible after it sets on, right? So what are these claims? Are they true? Are these misleading? Are these myths? What is it exactly?
Yeah. So it should not get controversial. But see, reversal we generally avoid. We doctors, diabetic clinicians looking after people with diabetes, because it could be misleading. And when somebody is living with a chronic disease, right, it's not right to mislead them and set their expectations wrongly. It's very important that goal setting should happen when your diabetologist is assessing you, looking deeply into your history, your clinical picture. At the same meeting, in fact, every consultation, goal setting should happen. Looking at next 3 to 6 months, 3 to 5 years, these are our goals. I want to be lighter. I want to have a normal cholesterol. I'm looking at reversing my fatty liver. Those are the things we should be looking at reversing. Reversal of diabetes, we call it remission. Remission of diabetes, yes, it's possible. It happens. But it is not something new. It has been just been, packaged or branded or termed a certain way. But pathophysiology, what is happening inside the body to cause diabetes or to worsen the sugar levels, if we don't attack that, everything else just is a misnomer. So if we are able to suppress our insulin resistance, if we are able to increase through mindful eating, targeted physical activity, it's not just walking for everyone. what works for you, what are your metabolic needs. So you have, say, more of fat percentage, less of muscle percentage, so you may need more of strength building exercises, muscle building exercises. It depends. So careful assessment of a patient's clinical picture, and then the treatment should be customized and directed towards their needs to meet their goals. So that is the thing with reversal, so called. Yes, remission, our patients regularly have been, even before this thing became famous, it has been happening. So many of doctors, they have been doing it for their patients. They drop down from 3 pills to 1, they drop down from 1 pill to 0. This happens on a day-to-day basis, depending upon patient's involvement, patient's interest, and how their body responds. There are certain things that sadly even we or the patients cannot change, and that is their genetics. But then again, their lifestyle is as important, and it can move mountains.